45 degrees. So she's able to flex the hip and then extend. And then do this one, 45 degrees, and she's able to extend. Right? So for the so that was for the flexion. So for the extension, please, face down. So as you can see here, the patient is facing down. Now I'm gonna ask her to lift up your whole leg. Great. And then lift up the other leg. Okay, as you can see, she's able to flex, and extend on this side too. Please turn around. Now for abduction, meaning like away from the body, lift your leg up a little bit, move it to outer wide. Great. Put it back. And then this one, abduction, then put it back. And then abduction, you're gonna put this leg and you move it over. There you go. That's a good extension. And then to this one, good extension. About 30 degrees. So, as far as like the range of motion for the hip, she's able to perform all of them: active range of motion and passive range of motion. Now what we're gonna do is a special test. It's called the Thomas test, and the Thomas test is basically a flexion is to check if the patient has the what you call this a defect occult in flexion contracture. And then what we're gonna do, we're gonna have the patient flex to the right knee, flex your right knee, right, and then firmly against the abdomen. So what I'm gonna do is I'm gonna pull against the against my abdomen to see if she has any contracture problem on the hip area. Okay, do you feel any pain?
No.
All right, great. So the other test I'm gonna do is called the Part2 test. The Part2 test is also to test the hip for sacroiliac joint, sacroiliac or joint problem. All right. So for this one, I'll press the left knee. This is the left knee right here, and then I'll put it over right here. Hold on. Relax your legs a little bit. Relax your leg. Relax. Flex your knee. Put it over here. So as you can see here, what I'll try to do is I'll try to push this against the examination table. If she would feel like any type of pain, and then that would be positive for Part2 test as well. Now the next thing is we're gonna do is the spine. Please stand up. Thank you so much for accepting all these movements. So as you can see here, the spine. Unfortunately, okay. So the spine area, I'll start checking from the cervical side, up to the C7 right here. This is a proeminent bone right here, and then I'll see the position of the cervical area. It's more of like on a concave mode, and then this one is, this one is like a inward indentation, and this one is, outward, position. And then so technically the way it works is it'll go in, out, and back in, and that's the normal shape for the spine. So I do not see any type of swelling. I don't see any injuries. I don't see any discoloration. I don't see any tendon. I don't see any nodule and so on. So the next thing we're gonna do is the palpation of the the spine. So as far as like the palpation part, I will first before I do the palpation, I'll look at the symmetry of the shoulders, right? I see that both shoulders are symmetric, so there's no scoliosis. And then I see that the iliac crest is also at the same level. And then if I would look at like the creases area, right, by the buttocks right here, the creases also is at the same level, so there's a symmetry to it. So that is the inspection. And then as far as like the palpation, um what I'll do is I'll palpate, the cervical site right here, and then I'll ask her to bend forward. Then as she bending forward, I can see she's able to perform like a flexion, right? And then I look at the position of the you know the position of the spine. I do not see any lateral deviation or any type of scoliosis or lordosis, right? So the spine, the process is totally normal. So now on the palpation, I palpate, every, please stand up. I will palpate, every, vertebra in between to see if there's any tenderness. You feel any pain?
No.
So I don't feel any pain. She don't feel any pain, and I don't feel any tenderness, right? And then I'm gonna, also check the muscles, the para supine muscles, the trapezius muscles, on both sides, they're symmetric. And then I'm gonna ask her to bend one more time, please. And then I'm gonna percuss the spine, with the ulnar surface of my right finger. You feel any tenderness?
No.
You feel any pain?
No.
So with the percussion here, it doesn't seem like there's any type of, you can stay straight. Any type of swelling or, tenderness or pain is felt, during the percussion. So, and I see that there's a symmetric, of the shoulders, symmetric of the iliac crest, symmetric of the creases on the buttocks, and the spine process is normal. It's straight line. There's no deviations. The next step we're gonna do is we're gonna check the we're gonna check the the next thing we're gonna do is the range of motions. So please one more time, please bend. Try to see if you can touch your toes. Great. And then stand up. And then please lean forward, backward. That's great. And then side to side. And then to the other side. Great. And then twist to the left. And then to the right. So as you can see here, the range of motion is also good. She did the abduction, the flexion, extension, abduction, abduction, and then she's able to to perform the whole range of motions without any type of limitation. We're gonna do a test. It's called the straight leg test. Please lay back down. The straight leg test here is that I'm gonna just cover the patient for a minute. Let me get a towel. Do you mind if I cover one side?
Okay.
All right, so I'm gonna raise this leg up to as high as possible. You feel any pain?
No.
Great. Any pain?
No.
Great. So as you can see here, with the straight leg raise, she's able to perform the entire, to raise the legs, over 90 degrees, without feeling any pain. So that means that she does not have any problem, as far as like the hip area. Now I please sit down. Let me just make sure that we did everything. We did the wrist, we did the elbows, right? We did the shoulders, we did the neck, we did the spine, we did the hips, we did the knees, we did the ankles, we did the feet, right? So that would basically conclude, the musculoskeletal examination. Do you have any question?
No, I don't.
I'm so sorry for all the moves, back and forth, right? But I thank you so much for the visit.
You're welcome.
Right.